Hi, this is Dr. A with the Intro to U.S. Healthcare. We're on Chapter 6 of the Basics of the U.S. Healthcare System by Nancy Niles, and we're going to look at outpatient services in this lesson. Okay, so the basic form of an outpatient service is a patient seeing their physician in a physician's office. All right, outpatient, you're not spending the night there, hopefully, right? You're just going in for an appointment and then leaving. Hospital emergency medical services are an integral part of the American healthcare system, and they are another part of outpatient services. So this is for the care of patients with emergency healthcare needs. They are often, of course, associated with a hospital. And as long as you just go to the emergency room and have care and then leave, then it is an outpatient service. And that's really what they're designed for. But of course, they're also designed so that if you come in and you need to be admitted into the hospital, then there's a doctor that can write admissions orders, and then you can be transferred from the emergency room into the hospital for services. So it's quite convenient having an emergency room right there in the hospital. So it is technically an outpatient service because then once you are admitted, you are out of the outpatient service and into the inpatient stuff, right? And in 2016, there were 145.6 million emergency department visits. That was a decrease from previous years. It could be the result of drugstore clinics and or urgent care centers that have really grown a lot. There's been an increasing number of those in the communities. Many outpatient clinics are found in teaching hospitals, so they use outpatient clinics as an opportunity to teach and perform research. If they are found in those teaching hospitals, often they are a clinic for something specialized, like a scoliosis clinic, a sickle cell clinic, or something like that, right? Large teaching hospitals may have 100 specialty and subspecialty clinics, and so a lot of times they might be the only clinic in the state where you can get that kind of care, and people would come from all over to that clinic to get that specialty care. So then let's talk about those urgent care or emergent care centers. So they are used by consumers who need medical care, but the situation is not life-threatening, and they take the place of the hospital emergency room visits, again, if things are not life-threatening. So, for example, you do not want to go to an urgent care center if you're having chest pains, because that could be a heart attack, so that could be life-threatening. So for that, you want to go to the hospital emergency room. But if, let's say, you suspect you might have a bladder infection, which is usually pretty easily resolved with an antibiotic prescription, that's a good case to go to an urgent care center. If you think you have the flu and you're not just really terribly dehydrated or anything, you can go to urgent care center. If you think you might have strep throat or something like that, urgent care visit, right? And why urgent care versus a physician appointment? A lot of the times what it is your physician is booked out weeks in advance, and you can't wait weeks to be seen if you're having this problem, so you need to be seen right away. The number of urgent care centers decreased from 9,000 in 2011 to 7,100 nationwide in 2016. This could be also just trying to make sure that they're not saturating the market. The average cost of an emergency department visit in a hospital there is about $1,000. But the average for an urgent care visit is about $200. So it's always cheaper to go to urgent care, but it's not always appropriate to go to urgent care. So there are some things where you need to go to the emergency room for it. The top 3 owners of urgent care centers are physicians, private investors or insurers, and hospitals. Next, ambulatory surgery centers. So there are surgeries that do not require an overnight stay. What do you mean by ambulatory? To ambulate means to walk. So think it's a walk-in surgery center, right? And so you can't just walk in and expect service. You obviously need to be scheduled and have a doctor that is deciding you need to have surgery, but you can walk in, have that minor procedure done, and usually have a loved one take you home. You don't have to stay overnight. The physicians have taken the lead in developing these ambulatory surgery centers. The first one was established in 1970. Hospitals have ownership interest in 23% of all ambulatory surgery centers, and 2% are owned entirely by hospitals. A lot of them are going to be affiliated with a hospital because, like, what if something life-threatening happens? You know, it's not supposed to, but what if it does? They have agreements where you can then be sent to a hospital if you need to be placed in intensive care for some reason. The procedures at ambulatory surgical centers cost nearly 50% less than inpatient surgeries, so that's why they're preferred. And patient surveys indicate over 90% customer satisfaction with their care and service in these ambulatory or outpatient surgery centers. Health centers, which originated in the 1960s, are part of the war on poverty. They are organizations that provide culturally competent primary healthcare services to the uninsured or indigent and poor populations, such as minorities, infants, and children. We have one in our communities, not far from our campus, and if you don't have insurance, that is a place you can go, like you would to an urgent care or for primary care. You can go there for a visit, and then oftentimes they also have resources, maybe free medications or cheaper care, and some of them require, if you can, to pay something, but it is so much cheaper than regular ones. And of course, these are, mainly to serve people that do not have insurance or do not have money. In 2018, over 1,400 health centers received federal funding, providing care for over 27 million patients. Home health agencies and visiting nurse agencies to provide medical services in a patient's home. So Medicare is the largest single payer of home health services, meaning the elderly are probably the largest population that receives it. But they also can provide care for people that receive Medicare benefits that are maybe disabled. Approximately 12 million individuals require some type of home health service. There are 33,000 home health providers, including 12,000 Medicare certified agencies. Your employee assistance programs are a type of occupational health program. They were established in the 1970s as an intervention for employee drug and alcohol abuse. They have expanded to offer other services such as tobacco cessation programs and mental health counseling and referrals. And so these are really nice. They're usually very low cost or free services that you can access if you have something that is going on in your life that you need help with. And then they can usually, if the care needs to be longer term, they can refer you to an appropriate facility. Respite care or temporary care programs were established also in the 1970s to provide a systematic relief or break to caregivers who need relief or a break, right? So if you are, especially a family that's doing the caregiving for a parent, it's constant, it's 24/7, and it can be tiring, and sometimes you just need some time away. So if you have a larger family where there are siblings, sometimes siblings can take turns, but that's not always the case. And so these are great. It forestalls a patient from being placed in a nursing home or a facility. Long-term care insurance can pay for a portion of respite care. It is typically considered to be 14 to 21 days per year. There are a variety of programs that are considered respite care, such as adult daycare programs. Hospice care provides care for patients who have life-threatening illness that cannot be cured, right? Cannot be treated. This is an end-of-life type of care, and the aim is to provide comfort care. Generally speaking, hospice care, you have to have 6 months or less, at least less than a year to live, but usually it's more in the 6 months range. This dates back to medieval times and focuses on palliative care, not curative treatment. Again, meaning it's not that we're doing nothing. We just want to do things to make the patient comfortable, control pain, and, still do some nutrition and things, helping quality of life in that last stretch of life, but we're not trying to, get rid of the cancer or make whatever disease it is better. Hospice care is covered by Medicare, private health insurance, and Medicaid for qualified patients. Could possibly also be under the long-term care. There are some home health agencies also provide hospice services, and there are also like hospice houses. So we have one hospice house in our little city, and so that's a place you can go to receive hospice care, but you can also receive hospice care at home. Senior centers, according to recent statistics, 10,000 senior centers in the United States serve approximately 1 million seniors every day. Their users spend about 3 hours per day, 1 to 3 times a week at the centers. So we have one in our area, and it does a lot of things for them. It gives them a social outlet to get together, but also helps them with lifestyle changes, exercise programs, and also like maybe rides to doctor's appointments and things like that. 70% of users are women, and the average age of attendees is 75 years of age. Your adult daycare centers, mentioned earlier as part of Respite care. In 1979, the National Adult Day Services Association was formed to promote these types of community services. So they established national standards for the operation of adult day services centers. Many adult day services centers are regulated by state licensing because they're a type of healthcare facility. And they could be also certified by a particular community agency. Over 80% of the centers offer also physical activity programs that focus on diabetes, cardiovascular disease, which could be more prevalent in the population that needs to use adult daycare centers. Literally think of them as just like kid daycare, but for your elderly parents or grandparents. And so the family member brings them to daycare, and then they go to work, and the elderly person stays at the daycare center. They do activities and crafts and fun stuff and games, and they get to socialize and do all kinds of fun stuff. And then when the family member's done, they pick them up, stop by, pick them up, and they both go home. And just spend the evening and the night at home. So it's a great solution. Again, keeps people out of institutions and allows the caregiver to also be able to work. Other outpatient services. So we have Planned Parenthood of America. It's a 100-year-old organization that provides family services to men, women, and teens in local communities regarding sexual health and family planning. So there are also clinics that are not associated with them that provide these services. The American Red Cross provides emergency response to victims of war and natural and man-made disasters. They really do work all over the world. The Office of Women's Health was also established by the Department of Health and Human Services. They have 10 regional offices that oversee women's health activities nationwide, and they can fund different initiatives and programs that enhance women's health. Next, we have the Meals on Wheels Association of America. So this one is older. It was established in 1954. It is the oldest, largest national organization composed of and representing 5,000 community-based senior nutrition programs. So they provide well over 1 million meals to seniors who need them each and every day. So this is for people, again, seniors who are living at home, who may not be able to cook. It may not be safe for them to cook. They may just not have the desire or knowledge to cook their meals every day. And if they're forgetful, they may start something and forget they're cooking, and then it burns and it's a fire hazard. And anyway, so that way they get meals provided to their home every day, and they get to eat good, nutritious meals. The Doctors Without Borders, or Médecins Sans Frontières, was established in 1971 by physicians and journalists in France. And they are an international medical organization. They provide quality medical care to individuals that are threatened by violence, catastrophe, or disasters. They have lack of health care in the area. been under a natural disaster, an epidemic, or war in 60 different countries. So they are really all over the place. Also, Remote Area Medical was founded in 1985 to develop a mobile, efficient workforce to provide free healthcare to areas of need worldwide. Again, so they're a clinic and they're mobile and they go to different areas to provide disease screenings and follow-ups and things like that. Also, telemedicine uses electronic information and telecommunication technologies to support long-distance clinical healthcare, patient and professional health-related education, public health, and health administration. We will dive deeper into telemedicine in the IT chapter. It is a great technology that has been just taken off in the last decade. So although hospitals admit 35 million individuals annually, the healthcare industry has recognized that outpatient services are cost-effective and consumer prefer those. Many hospitals, therefore, are buying up outpatient services to increase their revenue stream and to diversify themselves. Also, technology will increase the quality and efficiency of healthcare for consumers. Telemedicine has become a more widely used model for healthcare because of these continued advances in technology. The implementation of patient electronic health record systems nationwide will be the impetus for the development of even more electronic healthcare services. Again, this will be the telehealth and technology will be discussed in the technology chapter coming up in a few chapters. Okay, so this wraps up our chapter on inpatient and outpatient services. So it's chapter 6. Thank you.